Welcome back, everybody. We are in our Friday day of sessions for the 2023 Wisconsin Enrollment Conference. Great to see everybody joining us again. And we will be getting started very soon. Before we do that, I wanted to just review a couple of things I mentioned yesterday, and then also, of course, announce our gift card drawing recipients so far. And maybe we'll start with that. So yesterday I mentioned that we would be announcing today both those who were drawn as recipients for submitting photos during the registration process. So we've drawn 3 names from that group, and each person will receive a $25 gift card. And then we'll also be announcing the recipient of the $50 gift card for folks who attended all of yesterday's sessions. So let me go first to the 3 who submitted photos during registration and who will be receiving the $25 gift card. And we'll send out information to these individuals just to alert them, but I wanted to announce their names. The first is Stephanie Hartelman. The second is Nakia Goodman. And the third is Tina Chang. So thank you first very much for sharing your photos. We'd love to see our attendees. We'd love to see all who are registered and planning to join us in this virtual environment. And we'll be sending out information to you about your gift card. And then for those who attended yesterday, again, this is a $50 gift card drawing. So our first recipient just for yesterday is Amber Walt. Wonderful. So glad to have you all participate in that. We'll be doing another drawing. We'll announce the winner on Monday of today's attendees. And then same thing, Tuesday and Wednesday morning of next week. Wednesday, we'll announce 2, 1 in the morning and then 1 in the afternoon at the close of the conference sessions. All right, and then just a few reminders to make sure everybody can, especially get those who want pre-licensing or continuing education credits for attendance. We want to make sure you get those credits and that is as smooth a process as possible. So please do remember that your login link, when you registered, you receive an individual login link each morning of the conference. That is individual to you. So please do use that one that is sent directly to you. If you use one that is shared with you or from another, it won't register it won't show your name as attending in this session. And so it'll be difficult for us to give you the proper credit for those sessions. And so please do use the individual link that is assigned to you. If you, yesterday, if you used a different link, please do reach out to Elizabeth Rothy, the Covering Wisconsin staff. She will be able to make sure that the right credits are assigned to you for that day. And then if today you did also use a different link, go ahead, use this moment before we get started on the first session to leave the platform and then log in with your unique link. And that should get you all set up and ready to go for today. Another reminder that we do have the virtual exhibit booths that are happening this year. We're excited to be able to offer those. I know there were sponsors who were excited to be able to offer that as well and to meet and greet anybody who would be interested in just learning more about what services they offer. And then if you had questions specifically to them, you could ask that during that time. Those are happening every morning. So they're already closed for this morning, but they'll happen again Monday, Tuesday, and Wednesday, 8:15 to 8:45. All right. We will be sending out evaluations at the close of the conference, but we'll share more about that when we get there. I think we're going to go ahead and take a pause until we start at promptly at 9:15. And so you can just sit tight, don't need to leave, just stay where you are. and we'll come back at 9:15 to welcome our first session and get started. Thank you, everybody, for being here, and we'll see you in just a moment. All right. Well, let's go ahead and get started with today's opening session. And I will introduce our moderator for this session. So Adam Van Spankeren has worked with Covering Wisconsin since 2016. He currently serves as the Navigator Program Manager. In this role, he oversees the direct-to-consumer enrollment activities of staff navigators, while also handling his own caseload of consumer coverage requests. He monitors both Medicaid and marketplace policy changes and provides guidance to our team on how these translate to individual eligibility situations, often being the go-to support for assisters around the state on especially challenging and complex cases. He previously also worked for both ABC for Health and the Wisconsin Department of Health Services in education, outreach, and partner relation roles. Adam earned his undergraduate degree in creative writing from the University of Wisconsin-Madison, and I'm so pleased to introduce him and to hand it over to him for the opening session today. Go ahead, Adam.
Right. Thank you for that lovely introduction, Allison. I really appreciate it. And thank you to everybody for joining us today. I'm really excited to get going on this topic. We'll be talking about the upcoming changes to HealthCare.gov. As enrollment assisters know, there are always little things and big things that happen every single year to make our lives a little bit more interesting during this challenging time. Obviously, we have the unwinding on the table, but there's always more to unpack, especially when CMS starts tooling around with HealthCare.gov itself. So we'll be looking at those changes. But I just want to, before I dive into just a little level setting stuff on HealthCare.gov, introduce our main presenter, Ariana Anaya from Health Reform Beyond Basics, that is with the Center for Budget and Policy Priorities. Since 2014, Ariana has been working as a certified application counselor and navigator for enrollment entities in Chicago, as well as Austin, Texas. She is a subject matter expert who has served as a program manager, content expert, lead trainer. She's been recognized as pioneering enrollment strategies for individuals with complex medical and medication needs, including cancer and HIV. Her other areas of advocacy and expertise include health coverage education, efficient plan selection approaches, which we'll be talking about a lot today, application enrollment troubleshooting, network advocacy, balance billing, mental health parity, and public charge. So things that previous attendees will have heard about before, things that we all care about, and things we need to know for this open enrollment ahead of us. Ariana currently lives, I will say, where she's cooking up all of these trainings that she's been doing for states these past few months in a 163-year-old house in Montpelier, Vermont. And as I said, I'll be mentioning Health Reform Beyond the Basics again, but I'm just really pleased to have such experienced subject matter expert join us to be able to go through the plan selection and network assessment and things like that with us this morning. I'm going to go ahead and share my screen, though, so we can talk a little bit about some of the high-level policies for healthcare.gov and things that I want navigators, CACs, and other enrollment assisters to keep in mind for this upcoming open enrollment period. All right, so talking about policy to plan selection, what's new with healthcare.gov. We're going to look ahead at the marketplace for 2024 with a few hints of what's to come after. And I just want to say before I dive in here quickly to please use the Q&A function. Chat is disabled, but you can use the Q&A function if you have any questions. We will be monitoring that as we go through. And we will have a few opportunities to stop between sections to answer any questions people have. If they're particularly timely, I'll do what I can to make sure that they get answered and addressed quickly. But I know that Ariana has a lot to cover, so we'll probably take some breaks between polling questions and things like that to cover some of those and then pick up everything else at the end. So a few things that I want people to be aware of that we'll be talking about today. And these I've sort of devised a high impact, medium impact, and a yet to be determined kind of breakdown of my own design for what I think are going to be the most relevant and important changes that we're going to see for this year. In the high impact category, it was pretty obvious that we're going to talk about standardized plans. That's directly what we're going to be able to see. I'll just touch briefly on those before Ariana does the deep dive. There'll be some changes to automatic eligibility redeterminations that could be really impactful for the people who are affected. Medium impact, this was mentioned by Jenny Sullivan in yesterday's presentation, but there's a lower affordability test for employer-sponsored coverage. That threshold for testing whether or not the premiums for the coverage offered by employers is lowered. So that means that more people will have access to APTCs through the marketplace. There will also be some impact for employers depending on where they fell in terms of what they're offering their employees. So in theory, that will mean a decrease in premiums across the board. But regardless, it'll mean more people getting into the marketplace with APTCs, which is always a good thing. And then some things to be determined in terms of their impact are the proposed changes to immigration status eligibility. We'll just touch briefly on those. I think for the people affected, those are going to be really high impact, but depending on the populations you work with, you may or may not see them this fall. And then there's one change coming through the IRS about failure to reconcile. Whether or not the IRS gets ready to actually roll that out, we'll see. And I have some thoughts of my own on whether or not that will be particularly impactful. So for standardized plans, they're going to have a consistent actuarial value, out-of-pocket maximums, deductibles, and cost sharing for a given meta level across the board. So we're going to see a lot more consistency in the plans that consumers are seeing. Enrollment assisters, this will mean there'll be fewer plans. Issuers are going to be limited to just 4 non-standardized plans per product network type. And eventually that's going to decrease even more to 2. But there will still be these non-standardized plans next to the standardized plans. So there will still be confusion. And the things that we're going to want to watch out for are the fine details of the difference between a non-standardized and a standardized plan. I'm not going to dive too deeply into this right now because I don't want to steal any of Ariana's thunder later. But what is interesting, I mean, the standardized plans should offer the most obvious benefit for consumers, and the breakdown in terms of the different easy pricing and the different filters that people will see. But the non-standardized ones may look very much like the other plans, but the fine print may be a little bit different. So we'll all want to be on our guard and make sure we pay really close attention when we're helping consumers. For automatic eligibility redeterminations, I just want to let people know this is high level. We've all seen these. If you've been doing this work for a while, the newer people, you'll want to be aware of this. Marketplace enrollees who do not act at all or reapply on their own HealthCare.gov before December 15th will be automatically re-enrolled into the same plan if it's available, or similar one if that plan no longer exists. This causes, I think, more problems than it helps, at least for enrollment assisters. Maybe there are people out there who are fine with this year after year, but with the standardized plan options, it may mean many people cannot automatically be re-enrolled in their existing plan. Those plans just won't be there. So one thing that they have changed, the biggest change I would say to this, is that the new bronze to silver auto re-enrollment, if people would otherwise be enrolled into a bronze plan, but that plan is now gone, if that plan, if there's an alternative plan in that same network where the silver plan has cost sharing reductions instead, they'll be re-enrolled into that silver plan instead. When they would have been a bronze plan. So in theory, that will give them better coverage, better savings across the board. Remains to be seen how well that's going to work. I just want to let people know and really emphasize that doing nothing is always a risk for consumers, and this year more than ever. This is a population where we see people automatically enrolled, they lose their tax credits, they end up in plans that aren't right for them. Sometimes there are big changes. So everybody we can help anytime we can raise the awareness level about open enrollment. This is a population we can really help, because we see these cases early in the year, between January 1st and 15th, ideally, because then we have the easiest time fixing them. When people come to us after January 15th, after the end of open enrollment, and say, hey, my plan has changed, it becomes a lot trickier to help them, and often requires an appeal. So just see what this works out to be this year. It could be a little bit different. We may see some more of these, but it'll be interesting regardless. So some proposed changes to immigration status eligibility. I know that there are a lot of questions on this, or there have been, because it was really exciting when it was announced earlier this year. New statuses listed in the lawfully present residing categories. So we're looking at DACA here. That's people granted the deferred action for childhood arrivals, and people granted the special immigration juvenile status, or SIJS. So this could be in effect as early as November 1st. I hope that's the case. And then there are other changes that are just a simplification of different parameters for some of the existing categories of lawfully present residing statuses. And these include children under 14 applying for asylum, withholding of removal or relief under the CAT, or Convention Against Torture Act, This will eliminate the 180-day waiting period for those. Non-immigrant visa holders, this eliminates the not in violation of statuses language. For people with employment authorization documents or EADs, this eliminates specifications and clarifies that anyone with EADs meets the standard. And people applying for adjustment to LPR, legal permanent resident status, eliminates the requirement for an approved visa petition. So again, depending on the population that you work with, I'm thinking of Francisco Guerrero. I know you work with these groups a lot. You'll be hearing from him at the session later this morning. These are going to be really impactful for the people it affects. So just pay attention to those. And I just want to highlight one more potential change, although I have some reservations on how big of a change this may actually work out to be, is the changes to the failure to reconcile APTCs. This is contingent on the IRS being ready to implement in time for OE, so we'll give that maybe 50-50. This will be the marketplace determining consumers ineligible for an APTC if they did not file and reconcile their last tax credits for the last 2 consecutive tax years. Consumers should receive notice by December 15th with instructions on filing and then how to attest that they have actually reconciled them, basically giving them the option to get tax credits again for this year. And again, this is another scenario where if consumers do nothing, they will be auto re-enrolled without their tax credits. I don't think for enrollment assisters, just in all practicality, that this is a very large change. I think this is pretty consistent with what we've seen before for people who haven't filed. They tend to lose their APTC sort of abruptly when they go to renew. It just matters how long it takes the marketplace to catch up. So this could formalize that and standardize that a little bit, but I don't think in practical terms for enrollment assisters, you're going to see too much of a difference, although I am really curious about the language of the notices people will receive. So if anyone sees those as we approach December 15th, do share those back with the larger group, and we can see how effective they are for consumers. And just a few things to keep in mind for OE11 before I hand it off to Ariana. The marketplace uses the 2023 FPL guidelines for the 2024 calendar year. I think this is just worth noting because I know people, right now, for example, doing applications for this year, you're always looking back. So we're finally going to be looking ahead using the 2023 FPL guidelines, until this time next year when we're once again looking backwards. But just keep that in mind when you're doing eligibility for folks this fall. Open enrollment 11 is set to end on January 15th. That is a federal holiday. That's Martin Luther King Jr. Day. I would predict that they will say something in the 11th hour to extend that just another day or so, but we'll see if I'm right about that. And then, of course, the Medicaid unwinding continues during OE11 and beyond, which is just going to overlap and compound all the work we have to do. So I just want to take a minute at the very end here to use my platform to emphasize self-care for enrollment assisters. We are taking on and shouldering a greater burden, more responsibility than potentially we ever have before doing this work with the unwinding, with OE and all the the new changes. So right now you may be doing OE levels of appointment just with the unwinding. And I want people to be sensitive to that and really take some time, take care of yourselves. Otherwise, you may experience burnout, and you can't help consumers. You can't help people in Wisconsin if you aren't taking care of yourself first. So please, please, please take some time to do that. Whatever you need to do to be well this fall. And yeah, good luck, everybody. I'm going to close my sharing here, and I'm going to look to see if there are any burning questions that we want to address before we go ahead and hand it off to Ariana. There may be questions that are more relevant for her sections ahead, so we may table some of those, but thank you so much. All right. Let's see here, live Q&A looks pretty quiet. So I will go ahead and hand it off to Ariana to present. And I know that our people at UW Conference Services will be sharing the slides. And Ariana, go ahead and take it away.
Thank you so much. Adam, what a lovely introduction. It's always such a pleasure to be part of this conference. You guys are so incredibly well organized and you're doing so much. So thank you so much for having me. And yeah, let's go ahead and talk about some of these plan selection tips and tricks that I'm hopeful will be helpful to all of you during this upcoming open enrollment session. Next slide, please. So we're going to focus on 3 kind of major categories. I like to talk about things with examples, but this sometimes means I go into the weeds. I will try not to do that, especially as time is limited. But today we'll start by talking about some new and existent HealthCare.gov plan selection tools. Adam touched on at least one of them. We're going to talk about some strategies for narrowing the options. Plans have gotten, there are more and more plans, it feels like every year, and helping clients sift through those can be tricky when you have limited time to get however many hundreds of people enrolled in a given season. So we'll talk about some strategies for that. And then finally, I know that many assisters these days are actually continuing to work remotely, which may mean that you're servicing a population outside of the immediate medical network that you're familiar with. So we'll talk about some basic ways that you can swiftly locate information for clients who are perhaps outside your immediate service area. Next slide, please. And here we go. Section 1, new and existing healthcare.gov plan tools. So first and foremost, this actually just came up because I was building a ton of resources for Center on Budget and realized that all my screenshots were suddenly irrelevant because the display of how healthcare.gov shows plans, specifically in the shopping tool, has been very subtly altered. So what that means is just making sure you guys are all aware of where things are and what the implications of this slight plan display change is. So we're right now looking at a plan from Illinois, just as an example, because unfortunately, once they changed the display, I don't have access to what it used to look like. So happily, I had a screenshot from this plan in Illinois. And this is kind of the layout that those of you who have worked on healthcare.gov are accustomed to. Next slide will show us what the update looks like. You can see it's subtle. To my mind, it makes the print for deductible and out-of-pocket max a little smaller. It creates the plan name in kind of a headline as opposed to push to the side. These are not bad things, but one thing that is a little different is it's not showing cost sharing information the way it used to. So previously it would show primary visit, specialty visit, and generic meds, and sometimes additional information like the emergency room coinsurance. But now that is hidden. Next slide, please. You would need to, so here we are looking at, I think this is the Milwaukee shopping tool. You would need to scroll until you see the You Pay section. Next slide. So it's essentially to the left underneath the premium. And then once you click that open, next slide, please. One more. You will get a drop-down menu that lays out certain parameters in terms of the plan's cost sharing. So this does make it a little trickier, I think, to rapidly scroll through options because often the way a client remembers a plan is based on what it costs to see their primary or specialty doctor. So it's going to be an adjustment, but I just want to make sure people are aware that information is still there. And it is to some extent useful in that it enables the sisters to kind of organize the conversation, that you can begin your plan education conversation with a focus on premium, deductible, out of pocket, and then get to coinsurance and copays sort of with that information communicated to the client. So there could be advantages, but just wanted to call attention to this because it is a little bit different. Next slide, please. All right, Adam mentioned earlier that we will again, for the plan year 2024, have these easy pricing plans, which there had been a marketplace attempt to kind of offer standardized plans a bit back. I want to say 2016, 2017. But those went away, and it looks like this effort is sticking a little bit more. So in essence, these easy pricing plans within a given meta level all must share the same cost sharing. So I've noted some facts on the slide, but it has some advantages, I would say, for our sisters when it comes to plan explanations. And it does also have the impact of potentially creating a uniform set of plans within each meta level across each company. That can be a major advantage for someone struggling to understand tons of different health plans at once. It kind of gives us a quote unquote standard plan from which to talk about other plans, a standard plan from which to talk about the networks of another company offering a similarly standardized plan. So there are definitive advantages to what this will give consumers and potentially what this will give clients, assisters, which we will talk about just a bit more. Next slide. And here I've pulled up an example. And again, this is the new display that I've noticed of late on HealthCare.gov. It is a plan I used a Milwaukee zip code. I want to say a 35-year-old non smoking single woman at $25,000 estimated income. So that puts her at eligibility for 87% cost sharing. So you can get a sense of course, what those cost sharing amounts would be in a standardized plan. And so what this means is that all other easy pricing plans for this woman will have the exact same deductible, out of pocket max, and copays. So if you start with this plan when it comes to plan education, instead of having just explained how one plan functions, you will have explained as many plans as there are silver companies offering plans, because each of them must offer this plan in essence. Next slide, please. And this is just to kind of reiterate an earlier point. I want to say there's something in it. One more slide, please. Beautiful. So the parameters for this standardization is set by Health and Human Services. And so you can actually pull this information. It will be made available for 2024 to know, as much ahead of time as possible, what the coinsurance or copays will be at a given metal level. And of course, often the tricky thing to keep in mind for silver plans is that the client's income and eligibility for cost sharing reductions will impact what those standards look like. So, as opposed to just having one set of standards for silver plans, there will be four because of those cost sharing reductions. So, I've highlighted the version that my example lady from the slide before would be eligible for. Next slide. Okay. We're going to talk a little bit now about narrowing options and some hopefully helpful strategies to bring the plethora of plans to a more reasonable number and maybe even an order for that. Next slide. So I cannot say enough about how important I think the filter tool within healthcare.gov is. I constantly sing its praises in all all settings, and that is not to say that it is flawless, because it has many things that I would improve if I had that power. But this is a space in which, before you even begin discussing, the 136 plans on offer, or however many plans your specific network has, you can kind of give the client a bit of an overview. And you can also, in that moment, orient yourself. Because often, if you're working with a client from, let's say the rural northwest, you may not be overly familiar with their hospital systems or even the plans that are there. But this will enable you to kind of swiftly get a high level overview, rather than having to scroll through plan after plan after plan, trying to remember them, when, of course, the very nature of a shopping tool kind of makes them all appear the same. Next slide. So I'm pulling up the filter tool. I'm so accustomed at this point to its layout that I really hope it never gets tweaked. But I've basically, by saying that, kind of ensured through karma that it will be tweaked. But in any case, there are three areas that I really want to highlight. And of course, I especially want to highlight that this is a filter tool, that it can help you after you've provided a client with an overview and education of plans. It's great to return to the filter tool and to potentially see if a search with any of the parameters the client is interested in will net you a more reasonable number of plans. Often it won't, but this can be a wonderful start to just provide clients with that sort of soft overview. Next slide. So here are the three areas that I want to highlight. So first and foremost, obviously, different states and different cities within different states, different ratings areas may have different metal levels. Uh, there are platinum plans in other states. I think there's some states that have this expanded bronze category, which I keep seeing. But y'all in Wisconsin, at least as far as I've seen so far, looking at networks, luckily have this bronze, silver, gold, and that's a nice, manageable layout. And it also tells you the exact number of plans in each of those categories, which can be helpful if you understand what the client's medical need approximately kind of is, right? What level of use they're expecting to have. You probably know how many plans are available to them. And of course, for many people, the silver plan category is such a great place to start. So it takes you from looking at a list of 136 plans, which is devastatingly high to my mind, to a much more manageable, though still high number. And I want to say it says 47, but it's a little small from my vantage point. That element of the filter tool also allows you to search specifically for easy pricing plans. So were you to click on silver, a drop down menu would come right underneath it that allows you to indicate silver easy pricing plans. And that can be a very, very helpful tool. So the next part I want to call attention to is the health plan types. This is very useful to know. I've sat down with tons and tons of clients who have essentially said to me, I want a PPO right off the bat, where I'm like, well, unfortunately in this market, there is not a PPO. And sometimes this can really help have that conversation right off the bat. There are PPOs in certain markets. I'll show you guys, I want to say it's Green Bay that has PPOs available for 2023. But again, sometimes giving clients a brief education about plan types right at this moment can be helpful. And then finally, and I think very, very helpfully for those of you kind of learning a new market in a new year, is going to be the list of insurance companies. Next slide, please. So this drop down tells you exactly what issuers are going to be available within this ratings area, and also how many plans each of them are offering, which can give you a helpful sense of just your orientation within the explanations that are to come. Next slide. So this then is kind of the overview of all the information that the filter tool would give a Milwaukee assister working with that specific client. The client doesn't necessarily need all this information, right? But it can be a very, very helpful way to get started, to orient you. And that will better help you orient the client rather than just immediately diving into a plan, to sort of give them a sense of what the options and what the availability is. Next slide. So I looked at a couple of other ratings areas just because I was interested. So this is the Green Bay filter tool. Nothing bothers me more. This happens to me every year, and it happens to all of us, that we do these conferences on the eve of the next open enrollment before plans are released. I wish more than anything that we could do it after plans were released, but then no one would have time because of open enrollment. However, I think the awareness of what your market has in a given year can be very, very helpful to understanding what the next year is going to hold. You'll sort of start to see shifts in the company's offerings. You'll start to understand changes to certain types of cost sharing in a given plan. But you can see that actually Green Bay has more plans available than Milwaukee, which kind of surprised me. And does offer PPOs, which again, it surprised me that they would be offered in in Green Bay and not Milwaukee. So having that as a heads up for a client, being able to glance at this and sort of know your market is a very helpful thing. Next slide. I then moved, I'm so scared I'm going to say this wrong. I think it's a French name, Au Clair. So I looked at those plans as well. Here we sort of pivoted back to only EPOs and HMOs as a plan type. So there is that consistency between Milwaukee and this service area. Fewer plans and fewer health insurance companies. But again, there is congruency. You start to see which insurance companies are seem to be offering plans across the state versus those which are in some areas rather than others. Next slide. And then this is Spooner. Spooner is a town that I chose to focus on actually because of King of Queens, which is a ridiculous show, but for some reason I've been watching it. I think it's the last name's character. But Spooner only offers 42 plans, which is much more, I think, navigable for a client, for an assister. But obviously, it can be a little bit trickier because with fewer options, it might mean that finding primary care providers or hospitals, especially if you're unfamiliar with the area, could be a little trickier. Spooner also is offering only EPOs and HMOs. Blue Cross Blue Shield is represented. And then we have Medica and Security, which I want to say are in other areas as well, but we're also not everywhere, if that makes sense. So they're potentially products that were built specific to this area or intended to service a rural location. Next slide. I just wanted to give this. I always find providing definitions of the different types of health plans kind of silly because they're not always consistent. For an example, HMOs are supposed to require a referral to see a specialist. That's sort of the given definition of HMOs. But we're seeing more and more, and I looked at a lot of the HMOs offered in Wisconsin. Often they do not require a specialist. And in that respect, they do not require a referral to see a specialist. And thus, for all intents and purposes, they're essentially, in that regard, kind of more like an EPO, which doesn't require that referral to get to a specialist. I wanted to emphasize, because there are PPOs, at least in Green Bay, that a PPO is something I think all clients have heard of HMOs and heard of PPOs. And all they know is that HMOs are bad and PPOs are good. And while I can understand that perspective, the reality is a PPO is often not necessarily the best option for someone who has a limited medical budget. And this is because while it does offer you the ability to go out of network, it has a whole separate deductible and out of pocket max for out of network services. So it's almost as though you're enrolled in two separate health plans at once, one with rates connected to you going in network, and one connected to rates where you go out of network. So that is something clients often don't understand about a PPO, and it's helpful that they do. There's never going to be an advantage to going out of network. You always want to know your network and, best as possible, stick to it. Next slide, please. I wanted to call attention swiftly, just in case y'all are checking to see if the various HMOs in your network require a referral. If you're pulling open the summary of benefits for a given plan, you want to take a look at the first page. Sometimes this information will bleed on over into the second page, but it's usually the very bottom column of the important questions chart in the summary of benefits. And there is a specific question: do you need a referral to see a specialist? And we're seeing more and more. I think this is a plan in the Milwaukee area. The answer is frequently no, that sometimes very seminal definition of an HMO. Sometimes it is the case, but sometimes it isn't. And being aware of that can be a great help to your clients. Next slide, please. So I wanted to pivot back to how I think that the least expensive, easy pricing silver plan can be a useful tool for assisting clients with exploring their plan options. Essentially, generally speaking, I think the recommended strategy for providing plan education is always to start with silver for a lot of reasons. And I think I'm starting to recommend, I've done it for a bunch of different cities, I've done it for different states. One really good way to go could be to start with the least expensive silver easy pricing plan instead of just the first least expensive silver plan. You can do that by going into the filter tool, indicating that silver category, and then indicating with, I think it says with easy pricing. I think it says that there are 47 silver plans, but then 9 easy pricing plans. So you can imagine that with that, you've just made your life quite a bit easier when it comes to an explanation. Next slide. This is the plan we saw earlier, but then if you're using this plan to provide the client with an overview of how health insurance works generally, also though, how the marketplace plans are sort of laid out and how they communicate education, but also, the interaction between deductible, out-of-pocket max, and copays. You've essentially enabled them to understand this plan, but also the 8 other plans that are in this easy pricing category. And that's a big deal. It's very, very helpful to not have to explain something just as an example, but to be able to pivot potentially from this plan to another company's offering that has the exact same cost sharing. Next slide. Let's try next slide because there should be an image. Yeah. um, I like to organize how I approach these types of things. And how I approach this would always be to start by explaining the monthly premium. I explain then the deductible and out of pocket max before pivoting to explaining copays. But what I always recommend is building yourself a kind of little cheat sheet. An emphasis for me with premiums is to make sure clients understand that you pay it every month, whether or not you use it. That sounds so silly, but I cannot tell you how many times clients have come back confused as to why their plan was canceled. And it is because they didn't pay their premium because they didn't use it. So sometimes understanding a premium as like a gym membership or a newspaper subscription can help people a little bit. Understanding the deductible is something that the client must pay prior to the insurance starting to pay. But of course, there are exceptions to that in that you pay category, those items that have set copays. And then finally, helping clients understand the out of pocket max as the sort of worst case scenario number for in network covered care, and how the deductible and out of pocket max sort of fill up simultaneously to an extent. Um, Once you've done this, next slide, please. Oh my goodness. Next slide, please. Sometimes I get carried away with these animations. You can also start to ensure that they understand just the pieces of the layout, just they understand where things are located. And it's, of course, important that y'all understand that as well. You can see where that easy pricing label is right under the name of the plan, where the plan type is listed. But then also, it's important to be aware that the summary of benefits, the formulary, the provider directory are all kind of tucked away. And one thing that is a little helpful about this new layout is there's a section right to the right of the you pay where you should be linked to the different items that contain more information. So it should take you to the area of HealthCare.gov where you can locate things like the summary of benefits, the provider directory, the formula, and whatever else you need. Next slide. And just to kind of reiterate, we're going to do the poll in this next slide, but again, it's always a good idea to start with a silver plan because it is that sort of middle point between bronze and gold, right? When you start with a bronze plan to explain different healthcare, it can really distress clients because sometimes a bronze plan with high deductible and sometimes they don't have copays for services that may not be the first thing you want to explain to someone about the health insurance plan. So silver enables you to kind of start at a middle point and then move up or down based on the client's needs or their premium. And why start with that easy pricing plan as a way of explaining plans? The idea here is instead of explaining one plan, you're explaining 9. And then having done that, having assured them that this is the way a certain number of plans cost, and every company within this market has one such plan, you can sort of easily, naturally almost pivot to talking about networks. And then from there, graduate to talking about the nitty gritty of an individual plan, to talking about the bigger concerns when it comes to care. All right, next slide. And I think now would be a good time for us to do the poll questions.
Yeah, people should be able to see that on their screens now. Yeah, looks like we're getting answers in.
Oh, great.
So the label easy pricing refers to marketplace plans, plans with standardized plan design, plans with standardized monthly premium, A and B, or A and C. It looks like answers are somewhat divided. They're coming in. I think people are reading it very quickly and then responding and then reassessing. And let's give people another 30 seconds or so to respond to that before we share the results. All right, there we go. Results everybody should be able to see. Ariane, why don't you go ahead and tell people if they got it right?
God, I'm bad at technology. Yes. Well, so the answer was A and B, and it looks like the majority of y'all nailed it. Yes, easy pricing plans are marketplace plans, and they have a standardized plan design.
Great. And I was just looking at the questions. There were just somebody referencing the 6 insurances offered in Milwaukee. We can go ahead and supply those in the chat. That's fine. And then can we filter plans by selecting copay plans like we do for HSA plans? Do you know
Copay.
that stuff?
No, I
Yeah.
don't think you can. I can't think. I'm picturing it in my head. I don't think there's any way to do that. And I think the trick is what a plan has a copay for really varies.
Yeah.
Usually,
Yeah.
especially with silver plans, we have this we like to imagine we have the standard silver, bronze, excuse me, primary specialty drugs, right? Those are the
Hmm.
standard ones with a copay. But sometimes that's not the case. Like sometimes with it, you'll see a bronze plans where those don't have copays, but something like urgent care does. So
Hmm.
I think that's probably why you can't filter for it, is it would be a very challenging matrix um, for HealthCare.gov system to have to run through all the plans and select that.
Right. So would you recommend people get comfortable looking at plan documents then for that info?
Um, I think a plan document is important in certain respects, but I think that you pay section thus
Hmm.
far has been very accurate and they've also been very careful to indicate you pay and then it'll say the copay from day one,
Hmm.
which I think is a really helpful cue for the assister because sometimes clients get very confused about a copay being before deductible, after deductible, with deductible. And
Hmm.
that reminder that from day one, I think gives a good sense of the order of things.
Yeah, I think the language overall is getting better. I
Yeah,
think so.
it is
So
good.
I will go ahead and hand it back to you.
Okay. All right. So we're going to talk now about, I think the biggest challenge that we've all had from year one is this providers and provider directories and whether healthcare.gov's provider information is correct or whether the provider's information is correct. So we'll talk a little bit about some simple but hopefully relatively helpful tricks for navigating those different spaces. But I think always to keep in mind that, God, you guys have such a great network of support. And if there is a real issue with network adequacy, sometimes it's good to say to clients, you may not be able to see the doctor you want, right? This happens, that's reality. but there must be doctors available. There are laws connected to network adequacy. And if you are genuinely struggling to find, I don't know, a rheumatologist or some other tricky physician, this is a good thing to loop in your experts, the people at, the state level, just because there are laws here, and an insurance company and a provider have to sometimes make allowances for that. Okay, next slide. So something that jumped out at me was taking a look at the easy pricing plans. And I always kind of recommend people play with the shopping tool as soon as plans are released in November. But I wanted to call y'all's attention to something, which was when I looked at silver plans and easy pricing silver plans in Milwaukee, they have 9, but that's more than the number of companies in Milwaukee. So that made me think, huh, one of these companies or more than one of these companies is offering more than one product, more than one plan type. So I did a little digging and I found out that Quartz was offering that same standardized plan but has 3 iterations of it. And the reason it has 3 iterations is it has a buy-up dental and a buy-up dental and vision. So just to make you guys aware of that, that might be something that you see in the future where you're wondering, wait a minute, I thought there was only supposed to be the same number um, of easy pricing plans as there are companies because they're each required to offer one. If they have if they have different plan types, they are required to also offer another easy pricing plan in that plan type. So I guess because Quartz opted to have an easy pricing plan with dental and with vision, that accounts for that extra. But then the other thing I discovered, next slide please, is that Blue Cross Blue Shield, and this is specific to Milwaukee now. I haven't been able to figure out whether this is the case elsewhere, but also I haven't been able to I won't know whether this is the case for next year, but just something to be aware of. There were 2 easy pricing plans within Blue Cross Blue Shield, and all the values are exactly the same exact cost sharing. So what I wound up doing is you can see I'm comparing the plans. I don't love the comparison tool on the marketplace because it hides everything and because when you scroll it keeps the names of the plans up high, but then I see all the information, then I forget what information connects to what plans. So sometimes I'll take my own little notes on the side just so I don't totally lose track of what's happening. But next slide, please. When I went to the provider directory of each, and this is always tricky because sometimes you go to a plan's provider directory and you have to do a lot of work to actually tell that directory what plan and what plan network you're looking into. Luckily, that wasn't the case here. So when I went to these 2 directories, they actually had completely separate directories, which was interesting, and which the names hint at. They're both HMOs, they both have totally standardized, they have the same cost sharing, etc. Next slide. But you can see that there are different IDs for the networks that we're looking at. And in fact, the Blue Cross, the Anthem Silver Blue Preferred Broad seems to share a network with the POS network, which is bigger than the network, the Anthem Silver Pathway / Lean. So I did a quick sort of comparative search, and this is something I will do when I'm trying to make sense of this type of information. I just searched for primary care for each plan, and I came up with 360 primary care providers within a 20-mile radius of Milwaukee County, and then 818 primary care providers. So be aware of this. I hadn't seen this before. I have only ever seen one company offering 2 completely different plan types, and both of these plans are HMOs. So it's a little bit tricky that this one is. It's like it has the network of a POS without necessarily being a POS, if that makes any sense. So be on the lookout for that for next season in case that comes up. The Silver Pathway plan was far less expensive than the preferred, which makes sense. Next slide. Another quick way to check this sometimes is to use the HealthCare.gov provider tool, which I'll talk about in just a bit, and to sort of use information you know the answer to. For example, I was fairly certain that second hospital was not network with the Anthem Pathway Lean plan, and it appears to be a network with the broad plan. So another way to potentially kind of check your gut. Next slide. So the one thing I always like to emphasize with plan selection is it really is a balancing act. It's a very hard thing to get every single thing you want in health insurance. It's a very hard thing to get everything you want in life, actually. But the two factors that I think really help me talk to clients when it comes to selecting a plan is ensuring they understand that there's going to be this balance of cost and care. Cost is going to refer to things such as the monthly premium. That's usually the biggest cost consideration because if you can't pay your monthly premium, the value of your deductible becomes kind of irrelevant, right? You need to be able to pay that monthly premium, or no other factor within your plan will matter for very long. So, cost is usually where we start when it comes to plan education, right? We talk about the premium, we talk about cost sharing, the deductible, etc. But if at this point you've graduated to talking about care, about the networks, you've probably moved in a very good place where you can start to, with an awareness of what's available or what the structure is of cost, start to think about the where. Next slide, please. I keep trying to click it myself. All right, so this is a network overview, which I believe was built by Covering Wisconsin that Adam shared with me. Nothing makes me happier than this type of document. I'm always encouraging assister entities to help their assisters build this. And I'm encouraging individual assisters who are on their own in some rural area, build yourself this cheat sheet. It's hard and it takes time, and it especially has to happen when you don't have a lot of time. But it will save you so much work. It's such an important upfront investment. So I just want to reiterate that this item, if I had just explained to my client, okay, so here's how plans work. Let's take a look at the different places you can go with the different plans. In theory, you'd be able to eliminate certain plan options entirely if, the client wants a certain clinic or wants a certain hospital and network. So this can take that 47, down to half that. And then it can really just become a conversation about the logistics of perhaps one company over another. So this can simplify so much your assistance. Next slide, please. Now, the other thing I'm going to ask, next slide twice. Perfect. So the other thing to be aware of is HealthCare.gov does have this medication and provider lookup tool, and it's gotten better. It's gotten much, much better. I think that when you're first getting into enrollment, you can start there by putting in hospitals and doctors and medications. I would highly advise do not do that. Wait until you've actually given the client the plan overview, start with cost, then talk about care. I think sometimes the sisters don't know they can access that screen later on. So I wanted to quickly call attention. There are a couple of spaces within the shopping screen where you can access that same provider tool. So you do not have to start the process over. One is in the filter, and the other is at the top of the screen where I've highlighted in that orange color. Next slide, please. Likewise, if you scroll a little bit further down onto the actual plans, there's right next again to that you pay section. There's an area where you can just revisit that part of healthcare.gov. Okay, next slide. So it looks something like this. You'll be tasked with determining if you want to do doctors or medications. I must advise, I do not recommend using this for medications. It gives a simple yes or no, an X or a check as to whether, or X or a slash, as to whether a physician or a medication is in the plan. But with a medication, that is a more complicated conversation because medications have generic forms, they have brand forms, there might be all different types of information on the cost of a medication that you need to understand its coverage in a plan. This tool doesn't give that. It gives you a yes or no. And it just, to my mind, I've watched assisters like adding 20 medications, and it just is not efficient. It doesn't work. Likewise, it is a less efficient tool when it comes to looking up individual providers. I found I would say that your best bet here is to use it to look up hospitals or larger facilities. Okay, so not just a person with a solitary practice, but rather a clinic with multiple doctors within it. Always double check this information. Do not count on this tool to be 100% accurate. Use it like a kind of initial screening tool that requires further checking. Next slide, please. You type in the name of the whatever, and it will usually provide you with a drop down menu. And this, in and of itself, can be really tricky because often it's giving you names or departments within a larger facility that can be quite confusing. Next slide. And then again, so this is how it will appear on every single plan within HealthCare.gov. You'll either get this green check mark or I want to say a red X indicating yes or no. But again, use this as a guide. Don't use this as, don't assume it's 100% accurate. Next slide. What I always recommend is if you search a hospital and 14 different hospitals come up and they're different departments and some are dialysis centers and this, that, and the other, look for general acute care hospital. That tends to be the most successful way of getting that result accurately from healthcare.gov and from the provider directory. Okay. Again, trust but verify. Use the tool to kind of help you shape the search because you can, of course, search for plans that are in network with a specific hospital or use your network cheat sheet overview. But do not assume that this is 100% correct. Make sure you verify it, probably through the provider directory. Next slide. I wanted to give an example because I was looking at Spooner a little bit, just trying to see how this plays out, and I found this physician, Dr. Bray, has high ratings. I could imagine people in the area wanting the specific doctor. So I wanted to see what would happen if I tried to search for this physician. Next slide. So here I am in the healthcare.gov provider tool, and I've searched her name. Hopefully y'all can see this a little bit better than I can, but as I recall, the nearest they found people named something, but they're like 300 miles away. This doctor did not come up in the tool. Next slide. So then I went to Medica, which is one of the companies I want to say offered in Spooner to see if I could find her that way. And something I also wanted to call attention to is once you've narrowed down the plan search, you've started by using easy pricing plans, right, to kind of give clients a sense of how plans work. Then you could start talking about networks. And maybe the best way then is to use hospitals and major considerations to rule out certain plans or to focus in on certain companies. But what I find is once you're in the provider directory, more and more of them have done a little bit of work for us in that they are actually providing categories. So you can, rather than searching for a specific person, you can search primary care or urgent care or hospitals. And this I think is wonderful because a lot of clients don't have a doctor or want a new doctor. And that's a big challenge when clients just come in and they're like, oh, where should I go? This can give you a list. This can teach you to teach the client. Here's a list. Like, here are all the people. Like, let's start with this person. Find out what you think of them. Next slide. So I searched for this doctor, Dr. Bray, and again came up with nothing, which was very distressing. I want this doctor to be a network. This is one of the few primary doctors I immediately located in the Spooner area Why are they not showing up? And what I discovered through the internet, next slide, she's part of a clinic. And I was only able to see it by zeroing in on my Google search. She's part of, I want to say it's called Essentia Health. And for whatever reason, and this is true very frequently, clinics like this have a lot of turnover sometimes. I mean, depends. Have turnover, let's say, with their physicians. And so often when they're drawing up their contracts with the health insurance company, they're more focused on putting the clinic's contact than individual doctors. So always keep that in mind that if you're really struggling to find an individual doctor's name, sometimes asking the client or even doing a Google search, I saw it on her picture when I was like, oh, Essentia, what is this? Find out what clinic they work for, all right? Because it's a safe bet that you'll have an easier time looking up and locating a facility than you will the individual. Okay. My email is right there. You guys are such a wonderful, wonderful group to support. I so appreciate everything Wisconsin does. Let me anything I can help with. Yeah, I like helping.
Was there a second polling question? I can't remember.
I had two more, I think.
Okay. We can go ahead and I think queue those up if we haven't already. And we'll see. Yeah, so these are relevant for the PPO discussion and the HMO, the networks that you've been covering in great detail. Thank you for that. I saw some of the comments or the questions that this has been really helpful, and I can only agree. I think your tips on how to narrow down plan selection, on how to use the tools on HealthCare.gov, and things to keep in mind front and center while you're helping consumers are really, really important. And I thank you for covering them. So we'll give people a minute to answer the polls. We'll do one then the other, and we will go ahead and also give people a minute to jump in with any questions they might have as well. There have been a number of questions about whether or not these resources will be available. People really liked your slide deck, Ariana, and we're hoping to get a copy of it. So I know we'll make it available, but this is a new platform, so I will let Allison address that in the break following the presentation. So your question, in which of the following cities are PPOs available for 2023? And again, with your caveat, of course, that we'll see what happens for 2024. Like, it would be ideal to do this presentation at like midnight on November 1st, but we'll see. You know, it's not ever going to work out that way. Right. I think we've given people enough time with that question. Perfect.
And that really surprised me, just considering, the size of Milwaukee versus the size of Green Bay.
Yeah,
Always
definitely.
so interesting.
And then last question is which of the following is true about an HMO plan? A referral is never required to see a specialist. Out-of-network regular and routine care must be covered. Out-of-network life-threatening emergency care must be covered. It is the only plan type that relies upon a network of providers. People are getting their answers in now.
You guys are nailing it.
Yeah.
I always like
really
to add to that.
interesting.
Oh, I'm sorry.
No, go ahead.
I always like to add to that, just because I've worked with a bunch of people who had life-threatening emergencies out of network with HMOs, and just that great idea to remind your client, if this happens, they should really be attentive. Like, they shouldn't just expect it'll be covered. They should expect that there will be some bureaucratic hoofs to jump through, because this is one of those spaces where I think assisters are so important, is helping navigate balanced billing type stuff, because
Sure.
the ACA is a wonderful piece of legislation, but it's kind of only as good as those of us who work on it and enforce it. And this is a space in the law that we always want to be attentive to if someone's in that situation.
Yeah, that's 100% right. And similarly, if you just look at the front end of what you were saying about navigating the tools and the network inaccuracies and things like that, we give that warning to people right across the board when it starts. just to say like, hey, let us know what you find because as the Navigator organization, we'll let CMS know. We'll tell them because um, I just think only of the consumers in that situation who don't work with enrollment assisters because that's what they're going to do, thinking it's 100% right because of course they are, right?
Yeah.
So. Really, in terms of questions, people are really just kind of praising the content here, Ariana. So so far so good.
Thank you
I
all. Wonderful.
I know this is really helpful for folks. I will say, just if general, if you have any questions or insights on most consumers that we're helping, or at least covering Wisconsin, we're finding still want remote appointments, remote assistance. Do you have any thoughts on how best to do like the education piece and things like that while you're assisting consumers remotely, or how best to kind of get to that crux of the conversation, narrow down plan selection, either in person or remotely, just kind of the consumer assistance angle?
We did, so I haven't been part of my entity for a bit, but what we did do during COVID when it first happened was we kind of gave them homework, which I hate to
Okay.
even word like
Okay.
that, but we did ask them to have, if there were doctors or medications, I find it's a lot harder when I don't have someone sitting with me to figure out how a doctor's name is spelled or what the
Hmm.
I can show people stuff much easier when they're sitting down next to me. So
Right.
as much as I could, we did screen sharing, of course, for the plan selection stuff.
Yep.
But when I've got multiple windows going and I'm trying to research, all that auxiliary research that when I do it in person, I feel really good about because the client's right there and they're a participant in it.
Hmm.
So when I'm remote and I can't show them the same level, I like to ask them, and they don't have to send it to me. We don't do that, but for them to have prepared, do they have any specific preferences with doctors, with hospitals? Are there medications they need? Do they know the dosage? Do they know is
Hmm.
it the generic or the brand? Like just those things that become a holdup, I think.
Yeah, and I found that even more than just, obviously a little bit of a generalization, but even more than cost, I find the consumers usually first thing they care about is, can I see my doctor? Can I go to the
Yeah.
hospital down the street? So starting there is really good. We do have a question here from Sulaine. Are insurance providers good about updating their directories over the course of the year? For example, Essentia Health and Marshfield Clinic are negotiations to merge. If that happens mid 2024. Will marketplace info be updated? I don't know. You can't speak to Wisconsin necessarily, but do you have any experience with that, Ariana?
I would say always the problem with this type of question, it's, everybody's blaming the other one. You know what I mean? Is
Hmm.
it a healthcare.gov? Is it a provider? Is it a contract? Is it like, the problem is how much can go wrong um, between something that seems as simple as an update and how many people are involved and how many systems have to kind of be doing it right.
Hmm.
And I would say, we're in a media age and one would root for it to be right.
Hmm.
But I think healthy skepticism is the way to approach that. I think
Yeah.
assume it will eventually be right, but
It
perhaps not.
will eventually. It absolutely will eventually be right. And knowing Sue as I do, I will say, Sue, let's use that as our case study this year, and just see how long that takes and how efficient we can get
Yeah.
through that.
I
And then
mean,
there's a
we
question
we had
here.
we had insurance companies still negotiating their contracts like through open enrollment, and that was really hard.
It's a little scary.
Yeah, but again, standing by that talking point for clients, it may be a different clinic or doctor, but that is the law. There will be someone available. And I understand people don't want to change doctors, but hey, we want to keep people healthy. That's
Hmm.
important.
And then I see, is there a specific name for this tool when entering HealthCare.gov site? So if I'm not with my patients, how can I direct them to see the information? It's the plan preview tool, right? Like that's your go-to kind of bread and butter for OE.
Yeah, the
And
filter tool within it is the one I'm always like, the filter tool, pull
yeah,
that
yeah,
up.
use the filters.
Yeah,
And I know the URL is healthcare.gov/c-plans if you just want to immediately get there. And
yeah.
I'll share that as an answer as well here.
I love that. I love C plans and programs. Wow, I should know it really.
Hey, I
No,
didn't know it for long enough until we had a presentation like this and somebody said, hey.
it's C plans and prices is what it
Yep.
is. And what's funny about the link is it gets kind of hidden. I mean, outside of certain points in time, it's harder to locate than others. But I always just Google C plans and prices and healthcare.gov, and it tends to come up.
There is a question here from one of our navigators that you may not have any insight into, not having been prepared for it, but it is something we've been kicking back and forth internally here. And that's whether or not there's been any movement on the issue of insurers or pharmacy benefits managers and pharmacy rebates. So basically, if they're going to be applied correctly to copay assistance, or are they going to be correctly applied, I should say, to someone's deductible, the rebates, basically. So
It depends on
what's
the
been
plan.
happening?
Yeah.
Yeah. So
So what I found in Austin, we did a lot of work with people with very high medical needs who were eligible for copay assistance. So it's always been kind of sketchy because you're not supposed to use copay assistance with, I want to say Medicaid or Medicare, but specifically, um, healthcare.gov plans are not in that category. So it should be fine, but certain insurance companies have begun disallowing the application of a third party payment to
mhm.
deductible and out of pocket. So essentially, yes, you can use it, but it won't help you hit your cost sharing marks, more or less.
Yeah,
So
and that's frustrating.
there's kind of a lack, or there's been a lack of legislation connected to this, probably for a lot of reasons. But I think it's specific to the plan right now, whether a plan allows it or disallows it, as far as I'm aware.
Mhm. I
Um,
think that's right, or at least as much as we know right now. And Kirk and I, the navigator who asked it, will continue to dig into it.
yeah, it's a shame. It would be a good space for everyone's so weird about copay cards, and for me, it's like if someone has that high medical need and there's a copay
There-
card,
yeah,
what are we doing?
yeah, absolutely. There's a reason for it. I mean, there's a reason they exist because
Yeah,
at the end of the day, you can get through all this, you could get the right plan and get the right doctor, and you still got bills. You still got to figure
yeah.
that out.
Especially
um,
for a new medication, those have medications are hard on the body. If there's a new med, we want people taking it.
Absolutely. I'm just going to quick review the chat, see if there's any questions I missed before we hand it back to Allison. Um, Not a question, but a comment. Difference between Anthem Pathway and Preferred. Aurora Healthcare is only contracted with Blue Preferred, not Pathways. Okay, so there was confusion. That's helpful for people to know if you're in that area working with that. All right. I don't see any other questions other than the ones that have been kind of recurring as, how people are going to get these slides, how people can get the other resources we come up with, like the plan comparison tool. And I will leave those to Allison to address at least where we can share some of these resources when they hop back on. I know that plan comparison tool in particular was I think it ends up getting hosted on the MCAN Enrollment Assisters website. So we will go ahead and make sure that we get that right and make sure everybody knows where to find it. But really, Ariana, thank you so much. It was lovely to have you. We're so grateful for you sharing your insights, your knowledge, and I think this is really helpful for our sisters who are on the front lines during OE doing this work.
Thank you so much, and good luck to all of you.
Great, thank you.
Yeah, thank you so much. I do not conduct enrollment assistance, and I was telling Adam in the chat that I just so appreciated this content. It was awesome, and just looking at comments that came through in the Q&A, I can tell a lot of people really appreciated it too. So thank you again. And yeah, just to Adam's note about questions about where people will be able to see the slides and recordings, we will be posting those on our conference or through our conference webpage. It may take a few days. But they will be posted there. And if we're able to also specifically include a link directly to that MCAN, the Milwaukee Health Plan table that was shared, we will do that as well. Yeah, so hopefully that addresses people's questions. And thank you again. We will take a break now. And as you did yesterday, if you were here yesterday, you will leave this session, and then for the next session, go back to the platform, click on that link for that session, and then you'll go there. We will start there at 10:45 and continue on. Thank you, everybody. We'll see you in a bit.